All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is our second talk for today. I wanted to go over the various theories, mechanisms for the thrombosis associated with AstraZeneca. And I'm using the word associated and not saying caused by AstraZeneca, because it is really not known that is it caused by AstraZeneca. So associated means somehow people have started saying that, hey, this vaccine and this phenomena is occurring together. So there are theories like, number one, somehow the injection is administered incorrectly and the vaccine is ending up in blood maybe, or the air is injected. So that is one. Second is that maybe there is the heparin induced thrombocytopenia like syndrome, which I actually talked about 2 or 3 days ago as well. And then there are theories which are more distant from possibilities, but still there. For example, pregnant women and so on. So I wanted to make sure that we can go over some of these theories and understand the mechanics behind them, and then once again form our own opinion for what may or may not be possible. Again, I'm not going to feed you for what is the answer. I'm going to go over the mechanisms with you, and we'll see what makes sense and what does not. So the first one that I want to go over is the incorrect injection. So let's start. And logic here, I get your question. Can you explain why a vaccine might cause thrombocytopenia or neutropenia? And are there any conditions that would increase the risk? So I'll talk about that. That is one part of this whole discussion today. So sit tight and let's talk about it. A number of things to be discussed today. And if in the audience there are any nursing students, nurses, NPs, PAs, doctors who administer injections, if I make any mistake about deltoid and injection administration, please correct me. All right, so here, this is drbeen.com. Then this is a very good site. Actually, I really admire her work, Registered Nurse RN. And look at her subscribers, 1.32 million. So awesome work. And there is a intramuscular injection in deltoid, and the technique is given here. So that is a very good technique. So please watch it if you can. Then here are some of the things that I would like to talk about. So I'm going to start with the following. Let's see here. The theories that have been circulating, and these are going all over the place in the spectrum as well. Some folks are saying that AstraZeneca technology, being UK, is unfairly targeted by Europe and by US. Some are saying that the vaccine is totally fine. It is just the competitors doing this to them, and so on. So regardless of that, we are at a stage where these discussions are happening and people are concerned. So I wanted us to be educated and informed about what can be the concern and what may not be the right concern. So let's look at the theories. The theories are incorrect injection, that's one. Heparin-induced thrombocytopenia, or HIT. Then pregnant women, and where did it go? Can you imagine it became this small? I love this software. Okay, so the pregnant women on contraceptive, then already, this is important as well, already infected with COVID. Can you imagine this? This actually is a theory that is out there as well by EMA, European Medicine Agency. They are going to look at, is it possible that people who got COVID were already suffering from COVID? What I mean to say is, people who got COVID vaccine were already suffering from COVID, and then after taking the vaccine, they developed thrombosis from COVID, not the vaccine, and somehow this became associated with the vaccine. That is kind of a crazy thought, but anyways, that is a theory out there as well, and we'll look into that why that may be a crazy thought. So with this, let's start. So I'm going to talk about the deltoid muscle injection first, and the possibility of incorrect injection, and why the Danish study, and I could not find the study. If somebody has a study, please send me the link, but I could look at the remaining things, and why that study may have said that it is something to do with the not aspirating, and then should we really be aspirating or not. So I'm going to draw that here, but let me show you the links. So first of all, we're going to start with CDC. CDC says, when administering the vaccine, here is the question: do I have to aspirate before giving COVID-19 vaccine? And they say, no, you should not aspirate before giving any vaccine, including a COVID-19 vaccine. Aspiration can increase pain because of the combined effect of a longer needle dwelling time in the tissue. So they're saying that there is a needle and it is in the tissue, and if you're trying to aspirate, your hands are moving, that causes shearing and damage to the tissue, which may actually cause damage to the nerve underneath or damage to the blood vessels as well. So they're saying there is possibility of shearing or wiggling, and a discussion of is further given. So then their further discussion is here. And here, if you see in their pink book, they have various ages, various body weights, which dictate what kind of skin and the fat and then the muscle thickness may be present, and how much of the needle size should be used to make sure that you stay within the muscular region. So this is their various needle that they're talking about. Then here I want to talk about the deltoid muscle itself and kind of look at it together. So let's do this. So this is upper limb and its anatomy. This is, of course, a shoulder area. So what I'm going to do is I'm going to increase the view of the shoulder area, and this muscle here is called the deltoid muscle. This is this shoulder muscle over here. Now at the top of this muscle, if I hide this muscle, at the top here, you may be able to see this structure, this bone here, and you can actually feel that bone if you touch your shoulder at the top. That part of the bone is called acromion process. This acromion process here, so if you see here, this acromion process is the upper boundary of the injection site. Injection site is usually a triangular region for, so if you see here, this is that triangular region for the deltoid muscle. And let me try to get out of this. So going back here, this top bone makes the acromion region or acromion process, which is the upper part of the base of the triangle where we inject the vaccine. Then if you see here, below that, what is important for us to note are a couple of things that are important. Number one, do you see this nerve, this yellow thing here? This is the axillary nerve that is wrapping around the humerus, near the neck of the humerus, or near this bone here. So in the deeper part, next to the bone, is the nerve. Then similarly, next to them is the right humeral circumflex vein and artery. These are very tiny arteries and veins, very tiny, that are circumflex, meaning they go in a rotation. And if you see here, you can see them circumflexing here. So this is that artery and vein. And the injection is usually given in this area. If you see down here, this is another nerve in this area, this nerve. And then there is another nerve over here, that is this nerve. So there are a few nerves in this area and blood vessels as well. The reason this practice is stopped for aspiration, the reason for that is the following. Here, if I go and draw the deltoid muscle, so let's say this is the deltoid muscle, and deep to the muscle is the bone. So let me make the bone in, let's say, blue. This is the bone. And then wrapping around the bone are the nerve. I'm going to make nerve in kind of orangey to make it look. And then let's say a vein and an artery. That is the structure. So when we inject the vaccine, so outside of this muscle may be a bunch of fat, and that would really depend upon the gender of the person. Women usually have a tiny bit more layer of fat compared to men, and so this is the fat outside, and then outside of that is the skin. So let's say here is the skin, piece of skin here. So this is a structure that is out there. And when somebody is injecting, the point of injection is that the needle, if it is an intramuscular injection, then the point is that the needle should cross the skin, then the fats, and then reach all the way to the muscle. It should not reach deep enough to go and hit the nerve or bone or blood vessels. So the way that triangular area is specified, it is specified in such a way that there is actually no big blood vessel here anyways, but there is no blood vessel that is down here which can receive blood, the lipids or whatever is the part of the vaccine, or even air. But we are going to look into that and say, let us say if that does happen. But for the time being, let's just first understand that the vaccine would be then brought into the muscle here. And let's say this is the syringe and the hilt of the syringe, and then this is the rest of the syringe here. This is how this whole thing is. And what will happen is that the vaccine will be brought here and left here. And vaccine dose is 0.5 milliliter or something like that, a tiny dose. Over here in this muscle, we are not allowed to inject more than 2 milliliters. So it is actually a smaller dose that needs to go in here. This is the anatomy. Now, first question, can we actually be injecting incorrectly? That is let's say we talk about AstraZeneca, and AstraZeneca is made up of adenoviruses. So let's say this is filled with adenoviruses, these adenoviruses and whatever other substances they have. And imagine that these adenoviruses are somehow injected in a way, and this is totally, I'm making it up. They are injected in a way that the needle went in all the way, either connected with the vein or connected with the artery, and ended up injecting the whole vaccine in them. Very difficult actually to even intentionally try to do this, but let's say it would happen. So ideal state was it is here, but somehow this has gone into vein or artery. The question then will become that this vaccine, 0.5 milliliter of the material, if all of it goes in the vein or artery, can that then cause brain thrombi? So that is what we are going to look at right now. So going back here, if you can see that the structure here are pretty deep, reaching them. If I reset this and then I bring it down once more and open it up, this muscle reaching deeper in here and somehow going all the way to this nerve and artery, and then somehow trying to figure out a way to inject into this vein or into this artery, which is really next to the bone. It's kind of difficult, but let's now entertain this idea. So here we are. I'm going to go down to this part. This is a blood vascular system. So just a general idea. So let's now follow. Imagine that we are going to inject this vaccine. Let me take a copy of this. We are going to inject the vaccine in the vein first. So let's say this was the vein, and they did not aspirate the injection. to kind of make sure that they're not in some area which has blood, like vein or artery, and they just injected it. And the vaccine ended up in this vein. Now what will happen is all the blood returning from the veins will end up in the right heart. So I'm going to make it in blue. So this whole thing would eventually end up in the right heart. And please remember, veins are bringing the blood back towards the heart. So veins continue to become bigger instead of smaller. What does that mean? What happens is there are tiny small veins here. Then they collect together and they become a little bigger. Then these will then be collected together with more veins from other area and become even bigger. Then these would become combined with more veins and they would become even bigger, and they would continue to become bigger and bigger. So when you inject something in the vein, it is not going to become obstructed in the vein right away, unless it is really some big big thing which would just go and destroy the vein, which is not going to be with this vaccine. Or let's say there is some air as well. And also keep in mind that this is also possible that the air bubble is injected here in the muscle, or then it is going in the vein. So we're looking at the vein first. So air, the vaccine itself, all of that is going to end up in the right heart. From the right atrium, it will go to right ventricle. From the right ventricle, it will go through the output, which is the pulmonary artery. From there, it would end up in the lungs. What happens is the blood comes to right heart from the body. Then from right heart, it ends up in our lungs. Lungs do the oxygen exchange, the gas exchange in there. They bring in oxygen to the blood and they take carbon dioxide out. That oxygenated blood is then returned to the left heart, whose job is to pump the blood in the body. So you can say that the right heart is pumping blood in the lungs. So if I make an abstract diagram here, let's say this is the right heart, it is going to pump blood in the lungs. From the lungs, the blood would go to left heart. From the left heart, blood would go to then the body. And the body includes upper area, which is head and neck and brain, and then the lower area, that means everything other than them. So here what we have done is we have successfully brought blood into the right heart, from there into the lungs. Now the question is, that little vaccine that is sitting around in the blood, is it going to go to brain? And to bring it to brain, here is what we need to do. When the pulmonary artery brings the blood to the lungs, lungs are like a big sponge, correct? They are like big filter. So what happens is the big artery arrives, this is the pulmonary artery, and then in the lungs, it would start dividing into multiple smaller and smaller and smaller branches. Eventually to a point that the branches will become microscopically small. These are the capillaries. These capillaries make a huge mesh in the lungs where gaseous exchange is occurring, right? They're thin enough to allow the gases to pass through them, to oxygen to go into the RBC and carbon dioxide to get out. So now, if you think about that chunk, let's imagine that vaccine is really a chunk of lipid. Why I'm saying it is a chunk of lipid? So that it can stick together like a blob and go and get stuck somewhere. And we want it to go to brain and get stuck there to cause some thromboembolism in the brain area. You tell me, can that little tiny blob actually pass through this filtering mechanism? It cannot. So it might get stuck somewhere here, depending upon the size of it, somewhere in these blood vessels. Now, is there a bad outcome of that? Yes, it is. There is a bad outcome, and that bad outcome is that, imagine if this was a lung, then if you have stopped the blood, so lung gets double blood supply. They have one blood supply that irrigates the lung to provide nourishment to the lung tissue. And then there is blood supply that is there to get oxygen and remove carbon dioxide. So there is double blood supply. So in either of the blood supply, let's say somewhere here, the blob size was big enough that this blood vessel got occluded. Then the tissue further down where that blood supply was going, that tissue can be damaged. Usually our lungs are so big and so mushy and so filter-like and so large that a tiny bit of an area which may not be working does not really cause an oxygenation problem. It might cause pain or other such symptoms. There are cases where the embolus is so big that there is severe issue. There is a saddle embolus that can stop blood supply to both of the lungs simultaneously, and the person just dies right away. So I'm not talking about those. This is a 0.5 milliliter, and even the whole of it is sticking together will not make a big enough chunk to cause lots of damage. But important thing is, it is not going to come out of the lungs to go into the left heart. And unless it reaches the left heart, it cannot go to brain or it cannot go to body, because it is the left heart that sends blood that goes to brain and that goes to body. And the left heart, fortunately, is sitting next to this huge filter, which is sponge, which is lungs, which are like a sponge. So the lungs are going to sponge up or take up that extra debris that is coming in, and they might get little bit of a beating, but usually that debris would not end up on the left side. Having said that, there is a embryological condition where this actually can happen. And what is that condition? When our heart is developing, our atria, imagine this is heart, and these are the upper parts of the heart, and this is the lower part of the heart. By the way, my embryology lectures are very popular, and I have them on YouTube. So if you wanted to see development of heart, you can see this over there. So what happens is, heart, both sides develop as one chamber. Then we develop a wall between the right and left atria, and that is how we divide these into two parts. Sometimes this wall or septum that is developing, it does not develop correctly, and there is a hole that is left. This is called patent. Patent mean left there. Patent foramen ovale. Foramen simply means a hole. Ovale means it is oval in shape. So patent foramen ovale, if that is present in an adult or somebody who has now received the vaccine, and for some miracle that vaccine has actually entered their vein as a blob because the injection was incorrectly given, and the person somehow did hit that tiny vein and injected it in there, and that little blob ended up here, and then there was a hole in the septum, the patent foramen ovale, and that blob crossed the hole and went onto the other side in the left heart. From there now, from left atria to left ventricle, and then from there it can now go to brain. And this does happen in those folks who may have patent foramen ovale. But in adults, usually if somebody has a patent foramen ovale, they are aware of it. They have known it since the childhood that they may. And there are some adults who don't, but most of the time people know that I have a patent foramen ovale. They also know I need to close it or not close it. And so it's not most of the time it is not a hidden thing. In children, it could be not yet discovered. So that means if we want that little bolus to go to brain, we really need an abnormality in the foramen ovale to do that. And this kind of a thing can happen less frequently in the ventricles as well. So there is an interventricular septum that develops that separates two ventricles, and there can be sometimes hole in this as well, interventricular foramen, and that, or defect, and that can cause the things from the right to come to left. But for that, there has to be a lot of pathology to occur before right ventricle can send blood to left ventricle. And why is that? The reason is left ventricle. So now we are doing a whole cardiovascular system to just be able to say that this is not possible, that it is something to do with the vaccine injected in the vein. So let me explain now why ventricular side is going to be a difficult thing to have this. The reason is left ventricle is stronger because it has to pump blood into the body and it has to push a lot. Right ventricle is weaker because right ventricle's total job, right heart's job, is just to pump blood in the lungs, and lungs are kind of mushy, flexible, sponge-like thing. They can easily get the blood in them. So right ventricle doesn't have to work too much. So it is weaker. So now if you ask these two ventricles to compete with each other, then the left ventricle would win. So instead of blood going from right to left, it would be left to right. And when the left to right blood continues to happen for years and years, during this time, the patient would have lots of symptoms. Then the right ventricle itself will become big because now it is getting pressure from the left ventricle. And so that would become big, and now it has become strong as well, like a bodybuilder. Eventually, a time would come when the right ventricle would become so strong that it is now able to push the blood to the other side. But when this happens, you would have before that a long history of cardiovascular issues and the patient's right heart becoming big and becoming strong, and then this kind of an issue occurring, then that reversing, and so on. So it is not this that I just did not know and I had interventricular septal defect. Sometimes it can be very, very tiny defects. And so you would have to tell me that, hey, you know what happened once the administering of the vaccine was incorrect and it actually hit that very tiny vein and injected there. Then there was an issue with the interventricular septum as well, and there was a very tiny hole in there which was not really doing anything, but right was still able to send the blood to the left, which is really difficult, actually impossible. But let's say that happened. Then we can send it to the brain or the body. This is more common for foramen ovale to be patent. So in my opinion, if we said that from deltoid muscle, a vaccine or injection, which may be the vaccine itself or the air in that syringe, ended up in the body after becoming absorbed in the vein, it's quite a difficult thing to do. Now let's say if instead of the vein, the material ended up in the artery, so that will be here. Instead of this vein, it end up in the right anterior humeral circumflex artery. And I know that some of you are going to be kind of thinking that why are you even talking about it when this possibility is rare? But I think that is the only way to look at these things, to actually say, okay, fine, this may be the thing that is happening. So let's say if it goes in the artery. Now, what would that mean? Artery is not going to bring the blood back to heart. Artery, wherever you take the artery and inject something in it, it's going to continue the blood to the next levels. So it is going to bring the blood down in this area and supply here. So now if you, let's say, for some reason, end up, I'm trying to find some diagram that I can use. So no, I'm going to make a new diagram then. So let's say here is the bone. There is this circumflex humeral artery. And this artery would continue to supply blood in this area and continue to break down into smaller and smaller branches and eventually finish off. And somehow we added a bunch of vaccine here. That vaccine is now going to go through these branches and branches and branches, and eventually it is going to get stuck somewhere when the branches have become so much divided that they are very small now. So let's say it got stuck here. If it got stuck here, then the patient would have severe pain and there can be a tissue ischemia, depending upon how much of the obstruction occurred, tissue ischemia and some damage here in this area. in the arm. There will be no thrombosis, there will be no thrombocytopenia, there will be no cerebrovascular sinus thrombosis. This all will be here because arteries do not bring blood back to the heart. Arteries would bring blood continuously to the next peripheral tissue. Now, can we have the vaccine go to brain and do it? Pretty please, can we prove that? Yes, you can have an artery, for example, the artery going to brain, let's say carotid arteries, inject vaccine directly there, and then it will go in the brain. And then you can say, all right, fine, there is a problem in the brain. But in the deltoid system, if this goes in the artery, it would eventually end up somewhere in the arm, not even in this area, but somewhere over here, and that's it. So is it possible that we would end up with the vaccine somewhere in the tissues? Rarely. Now let me add one more concept here and then answer that one. The next concept is, let's say we say, you know what? We are not even talking about the bolus itself getting stuck somewhere. We are talking about it that the bolus has ended up in the blood. That in itself is a problem. And that would cause thrombosis by that bolus. So let's say here is the blood vessel. And in this blood vessel, we have various blood cells, including these platelets and RBCs and WBCs and monocytes and so on. And we have gotten the vaccine here. Now this vaccine is somehow going to cause these platelets to start becoming aggregated. And that is what would cause thrombosis. So once again, it's a very simple answer here. Question is, where did we inject it? If we injected it in the artery, that means in the outgoing blood, then sure, the vaccine might get lumping with these thrombi and it would just get stuck. But that thrombus will not be throughout the body. That thrombus will not be going into the brain. It would be some pain here in the arm area, and that's it. On the other hand, let's say this vaccine ended up in the vein and it clumped somehow. It doesn't do this. A vaccine cannot do this, or a substance cannot just go in and start clumping with things. But let's say it goes in and, hey Luffy, it goes in and clumps with platelets in the vein. And then it starts settling down somewhere on the vein. Then sure, it would just settle down on the vein and there will be one thrombus somewhere. And because the veins are becoming progressively larger, that thrombus would just be sitting somewhere on a vein coming back from the arm towards the heart. And so because it keeps becoming progressively big, let's say if it is not sitting on the wall of the vein, but that vaccine with some lumped together platelets, they all end up in the heart, then the whole story is the same. Heart is big enough of a structure, it would send that to the lung would filter it out somewhere, and that would get stuck in the lung. So can we have much more thrombosis in the system? No. So can the incorrect injection of the vaccine itself cause thrombosis to the level where people are now getting thrombosis and they have headaches and they're becoming sick and they're dying? That's not going to happen with this one. Now, if one more concept here, if the local vaccine had some air as well and that got stuck here, doesn't matter, air will get absorbed soon enough. There are times that air can be fatal. For example, 2 milliliter of air going to brain can be fatal. 0.5 milliliter of air going to cardiac tissue can be fatal. But once again, we have to absorb this air, 0.5. Imagine the whole syringe is filled with the air. That would mean 0.5 milliliter of air, which is not going to happen. But let's say that is the case. Then it has ended up in the tissue. It needs to be absorbed in the blood and then it needs to go. Normally, when the air is in the muscle, it can cause a little bit of cramping there, but it cannot just all of it be absorbed in the blood in one chunk and then go and get stuck. But let's say it would do that. So once again, if it is going to go in the vein, then it is going to end up in the heart, in the lungs, and lungs, there will be some pain somewhere and done. If it is going to be ending up in the artery, then it would go downwards instead of going towards the heart and the body. So the downward somewhere in the arm, and there will be some pain, and that's it. So I hope that this is, at least from an anatomical and mechanical point of view, clear that the injection accidentally into an artery or vein, first, is very difficult, and secondly, even if we deliberately do it, 0.5 milliliter would either end up in the lungs or the arm. It would not cause bigger thrombocytopenia or thrombosis. Now let's look at the next theory. So incorrect injection site here in the deltoid, not really a problem. So I'm going to just go over some more of the data here. Our colleagues here, our nursing colleagues, they know it very well. This is that triangle. This is how to administer. These are various needle sizes. I'm going to just keep closing them as well so that my computer is less under pressure. This is another Wikipedia here, that how to administer the injection and where are the sites, and that is there. Then this is another one which is important. This one is shoulder area injury, because of deltoid muscle. So please now remember, this is a shoulder injury because of a mechanical issue, not because there was some local thrombosis that was occurring. So what happens is, in this shoulder area, I wish I didn't close that 3D diagram. So if I touch my own shoulder, I hope you're still with me, and I'm not just speaking to myself. So this is the shoulder, right? If the needle is too high, we can actually cause injury to the bursa here, which is between the acromion process and the humerus. There is a bursa here, and sometimes we accidentally damage it, and then we cannot raise our hand like this. It causes pain. So bursitis can occur. There can even be necrosis of the bursa if the material in the vaccine is irritant or injection is irritant. So local damage. Then if you go down, then we have the axillary nerve, which I showed you. If axillary nerve or the radial nerve here, if these get accidentally the injection, the patient would feel immediate burning sensation, and they would not be happy. They'll have burning sensation. Their arm would, on some parts of the arm, would stop moving, and they would be in pain. And this can either be a permanent damage or can be less permanent damage. But that is again a local injury. Then after that is the muscle itself. Sometimes in obese patients, if the needle size is not correct, it is possible that the injection ends up in the subcutaneous tissue that is below the skin in the fat layer instead of going all the way to the muscle. That can cause fat tissue injury. Fat is very delicate, and if you put some irritant there, it might cause irritation, and that would be very painful. Plus it would become red. It can even cause necrosis there, or the local tissue injury there. So that is also possible. If you go down too much, there is radial nerve that can get affected. One can actually inject so deep that the bone can be hit and patient would feel pain. And please know that the healthcare professionals, nurses, they are pretty trained, experienced, and they're safe in this thing. This is what can go wrong. And so usually there is, you won't see this kind of injury even with these millions of doses that have been given. There are lesser reports. But this is an injury that can happen as well. So if you see too high, what would happen? Too far to the side, too low, what can happen? And so there are local injuries that are possible. Okay, so next. So then this is another link. These are all the links in the description as well for you to read them. So this is the standard needle length for the deltoid muscle. So I'm going to close this as well. This is air embolism, that if air is administered, So it really depends. For example, air administered in the carotid arteries can go to brain and just kill the person because of that embolism, or air that can go to the heart. But the thing is, for that, you have a central cannula, or you have central lines, and those can have the air. It needs to be those specialized areas directly punctured and air introduced. Or, for example, somebody got an injury on the neck that opened their carotid artery and they got air going in from there. But from deltoid, getting the air through all of this, going to the heart, and then passing through the lungs, where the artery becomes the smallest possible artery, and then it would become big again, then it would go into the heart, and then all the way to the brain. That's not an easy thing to do. So then the aspiration, should we do or not do, is a very different kind of a concept. It is interesting that there is a Danish study, I haven't seen it, that says this is what happened. And then as a result of that, I believe that Denmark government has asked, or the health authorities have asked, that, hey, try to aspirate and see it. Aspiration normally at the deltoid can cause a little bit of irritation and displeased patient. Okay, so continuing on. Other theories. I'm going to go to this one, thrombocytopenia, heparin-induced thrombocytopenia, and if there is a possibility like that. I had actually talked about it a few days ago as well. There is a possibility of something like this. Again, is AstraZeneca doing it? We don't know. I have not read anywhere that this is the mechanism. So I'm going to explain what that theory is. Theory is this. So I'm going to first give you the example of heparin. Heparin's job normally is to do blood thinning. But sometimes if a patient has a specific condition, it can, instead of causing thinning, it can cause thickening, or it can cause clotting. So the opposite of what its use is. And how does that work? So here is what happens. Let's say this is a blood vessel. In this blood vessel, you have injected heparin molecule, right? Sometimes, so let's say we make a platelet here as well. Platelets are these little tiny things that are responsible to work in clotting, right? So these are various platelets just running around. They should not be, I should not show them as clotted. So let's separate them from each other. You would say, well, they are already clotted. So they're just running around, having fun in the blood. They're zipping around. Sometimes platelets release a protein, it's tiny molecule, which we do not know what is exactly the function of that. So I'm going to show you the link as well so you can read it. So here. So this is the diagram, and this link is present as well. And this is the mechanism present as well. So you're not just saying that, all right, Mubin is just talking from his own mind. So here, this thing is called platelet factor 4. Sometimes this heparin that we have injected, and again, is this something to do with COVID? No. So this is just a separate phenomena that scientists or some doctors are saying maybe this phenomena is similarly what is happening with COVID vaccine. So first we're trying to understand what that mechanism is, then we'll see, can vaccine do that? And this also goes to logic's question that, can we explain how thrombocytopenia can occur by a vaccine? So here we have heparin. Instead of the vaccine, we're talking about heparin. Heparin binds with this platelet factor 4, and this structure that is formed, this structure becomes a target for immune system. Why? When this platelet factor 4 binds with the heparin molecule, there is a conformational change. Conformational change means, and I wish I had been sharing my screen. So not too much is done, so please don't mind. So here we have the blood vessel, and these are platelets, and here is the platelet factor, and that platelet factor 4 is present. This platelet factor 4 can bind with heparin. This is heparin that we injected. This combined structure can develop a conformational change. What does that mean? So if you look at my finger for a second, let's say my finger is heparin and it is straight, and you attach something to it, let's say this thing, and the finger changes its shape and becomes like this. This change of shape, because in a protein, because of the electromagnetic forces that appear when some other molecule attaches with it, that change is called conformational change. So let's say this heparin undergoes a conformational change and becomes something like this. And now we have platelet factor 4 attached to this as well. And this becomes a combined target. This heparin molecule becomes immunogenic. It was not immunogenic before, meaning it does not cause botheration of the immune system. But after changing its shape, immune system forgets what this is and says, what the heck is this? I'm going to attack it. And when these antibodies are made, these antibodies can then attach with the platelets as well, because the platelet factor was coming from the platelet. So there is a similarity there as well. Plus, these antibody complexes would start settling on the endothelium. So what would happen is these guys would settle here, plus these guys would attach with the platelets. That would cause local injury in the blood vessel, and that would then cause thrombocytosis. Now, this thrombocytosis and then thrombocytopenia will be generalized in the body everywhere. Depends upon the amount of heparin. It may not be lethal, but there may be bleeding that would start occurring, or there may be, thrombosis that would start occurring. And as soon as the doctors finds out that this is what is happening, they can discontinue using heparin, use something else, and within 2 to 3 days, patient can recover unless the damage has been too much. Now, this is thrombosis and then thrombocytopenia. Thrombosis, as I discussed before, is the plugging or plug formation or clotting because of the platelets aggregating. And if it is widespread and too much platelets have become consumed in this, then in our blood system, we do not have enough material to create more clots. And where we actually need a clot, we cannot make a clot, and then bleeding starts occurring. And the platelet numbers are now reduced because they're consumed in making thrombus. And so we say now thrombocytopenia has occurred. And I believe that day when I was saying these are called Bernoulli's, the blood currents that become disrupted at the branches are called eddies. So these eddies would cause damage to the blood vessel, and there'll be less platelet, and there can be bruising there. Now, how do we connect this to the vaccine? I had done this discussion 2-3 days ago. It is possible that here is a platelet, and the vaccine can attach to platelet. So let's say it attaches to platelet like this. So this is a antibody produced by vaccine. And please remember, it will not be produced the same day. You got the vaccine today. Antibodies would be formed after 7, 10, 15 days. Remember, the B cells have to become activated. So the first will have the dendritic cell that would receive the vaccine. Then it would give it to the naive T helper cell. Then that would cause T helper 2 pathway, and that would cause B cell to become a plasma cell, and that would make antibodies, or T helper 1 pathway, and that would bring into this cytotoxic T cell. But this whole process takes 7, 14, 20 days. So if this was going to happen, it will not happen the same day. It would start happening a few days later. In some people, 3 days later, 4 days later. If somebody was already exposed to this kind of a thing, like let's say they were infected before, they might even have it earlier because they would have the antibodies. So let's say the antibodies are generated. These antibodies, 7 days, 10 days later, now they are connecting with platelet. They were not supposed to connect here, but let's say they got connected here. When they got connected here, they would cause platelet activation, and platelet would start releasing activation materials that would then cause platelets to start becoming clotted as well. And as soon as that platelet activation occurs, thrombi would form, they would settle on the blood vessels, and then emboli can run off to various parts of the body, including brain. And because there is no concept of this happening only in the veins, This would happen in the arteries as well, including the carotid arteries and these areas. So this can go to brain, this can go to other parts of the body as well. And this is why deep vein thrombus can be formed as well. So this is another possibility. This is more plausible compared to somehow injecting something wrong in the deltoid muscle and not aspirating correctly and that causing something. This is more plausible. But again, is it happening? Don't know. Then, so I hope, Logic, this answers your question as well. Now, question is it possible for us to know that this is happening? So yes, I want to show you this thing here. And I liked it. So this is cause of thrombus found in AstraZeneca vaccine. And this is what I just explained to you. And if you go to the end of it here, they say that we can actually do a blood test to find out if this is happening. And do you know what that test is? It's very simple. That test is to find this, in the case of heparin, the test is very simple. They can actually find these misfolded heparins and the antibodies against them. So they inject, or in the test, they take patient's blood, and that blood is mixed with antibodies that are against these antibodies. So if these antibodies were present that were connecting with the heparin and the platelet factors, which would then also attach here, then we can detect them. So they are thinking that maybe that test can be used to figure out if this is happening. The problem is that this antibody that is produced in case of heparin is going to be slightly different from the antibody that is produced by the vaccine. So it is not necessary that that test would actually detect it. But as you can read here, this disease can be found with a blood test. Clock does wonder when to start the blood test. So because let's say the vaccine is given today, will the person develop the antibodies tomorrow, day after, 3 days later, 5 days later, 10 days later, 70? We don't know. Everybody responds differently. So this is correct that he's saying clock does wonder when to start the blood test. Number one. Number two, headache can be a symptom of this. But many people get headache without this reason after the vaccination. So he's also saying who to test. So this is another theory. And for this theory, there are possible tests as well. Again, all of these links are in the description. So you're not thinking I'm just making up these things. Okay, next. Other theories. And I'm just going to quickly now go over these other theories. I can't imagine we've already spent 1 hour in it. So first, the vaccine could be triggering an immune response in which the body produces antibodies that could result in blood clots. I just explained it. Then CVST, so cerebrovascular sinus thrombosis, though rare, has been associated with pregnancy and the use of oral contraceptives. This is what Phil Lee that day was continuing to ask, that, hey, maybe it is this. So what they're saying is maybe the patient, because it occurred majority in women, they're saying maybe these women were pregnant and it was really not a vaccine. They just were getting these thrombi because they were pregnant. For me, that is very simple to answer. Ask if they're pregnant. So then this, anyways. Then EMA also intends to investigate whether those who developed the condition had been infected previously or at the time of the vaccine with COVID-19, which causes blood clots. This became a slightly not very convincing statement. Here is why. Think about a person. So let's say here is a person. Now you're going to see how Mubin draws a person. My apologies for weird, less awesome drawings. But let's say this is a person. Now, what you're saying is the person got vaccine today. Vaccine today, let's say today is 24th March. They are saying that the person was already infected with the COVID. So let's say on 20th March, person had COVID through their system, nose, mouth, eyes, whatever. They have COVID. They got vaccine here. A few days later, the person actually developed COVID disease. So I should have said, instead of COVID, SARS-CoV-2 here, SARS-CoV-2, they were infected with it. And then a few days later, they developed the COVID. And what they developed was headaches, because COVID caused thrombosis, which then caused brain blood vessels to be thrombosed and caused headache or other thrombosis in the body. So here is my ignorance here. What I could not find otherwise than the vaccine, any case where SARS-CoV-2 directly caused thrombosis in the head without doing anything else, without causing sore throat, without causing any dry cough, without causing any issues with the respiration, but just a few days later, headache. And that headache also not because of the cytokines or others, or any other, like nasal olfactory nerve area issues, but headache because the COVID caused thrombosis, and they are running around, they're walking about, but they have headache because thrombi are occurring. So maybe it is possible, again, it is medicine. It could be just my lack of knowledge and ignorance, but that would be really difficult to say that the person directly developed COVID, headaches, and thrombosis, and it was nothing to do with vaccine. And again, I am not implying that this is something to do with vaccine. I'm just looking at the theories to try to make sense of them, that this may not be anything to do with AstraZeneca. So then, next theory. So have we gone through the theories now? Pregnancy, contraceptives, headache because there was already COVID there. Vaccine could be triggering an immune response, which could actually be there. We've talked about it. Incorrect injection doesn't make too much sense. Then they say several US vaccine experts remain cautious about the antibody hypothesis and said the high level of publicity of the events could be causing more clinicians to report the condition than normal, which would make it appear that the events are related to the vaccine. So some folks are saying, hey, this is how bias occurs. That, hey, you are just making this news too much. And now, even if this was not the case, people are just going to start connecting these dots and say, this is why it is happening. So fair enough. And then the US experts also question why such events would occur only at increased rates with AstraZeneca vaccine and not the vaccine by Pfizer and others. Now, I cannot vet this statement unless I go and check that data by myself. So it is written here, fine. It is in routers, fine. But it just is an anonymous thing, US experts. So really this is happening or not, I don't know. I have to do that research. So I would just take this with a grain of salt. So now we have gone through the hypothesis. We have talked about this as well. We have talked about this as well. And then here is the test for heparin-induced thrombocytopenia. I'm going to stop here. I took your 58 minutes. I hope it was valuable. How was it? Did it help at least see that what may be possible and what may not be? It is entirely possible. Nothing is associated with AstraZeneca. It is just doctors now making a hoopla. Or it may be that AstraZeneca is doing something. And then it is a fair question that if this vaccine is doing it and it is creating spikes, then other spike generating vaccines, why are they not doing it? So there are questions that need to be answered in that way. So with this, I'm going to start. We can do a chit chat now after this, but I wanted to make sure that we give it a fair treatment to understand that what could be possible. Please like, subscribe, and share. And I think in this particular case, sharing this would be useful for some of the folks who may be hesitant, just thinking that, hey, the injection is going to be incorrect and now they're going to just inject in our nurse is going to just put it in my blood and I'm going to be a dead meat. That's not going to happen, neither the air. So this is, or the thrombosis because of that. And then possibly can the immune system, if that is the case, I think either share this link, if you would not be able to share the video, share this link so that if somebody has the headache or something, they can at least go back to their doctor, share this link with them and say, please get this test done at least. I do not know how valuable this test will be, but there is at least something to test. So with this, please like, subscribe, and share. That is one. Number two, there are 3 links in the description. One is to, if you would like to buy me a coffee, then there is another link to be a patron, and then there is another link to support this work in general. Thank you very much, and I would see you again in a few minutes in Chit Chat.